Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us, as always, is Dr. Robert Popovian, joining us from Washington, D.C. He's a pharmacist, economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, Conner Mertens from Seattle, Washington, my co-host and our patient advocate and community outreach manager.
And today, Robert, we're also joined by Ben Blanc, dialing in from Indianapolis. He's our producer and happens to be manager of programs and special projects at GHLF.
Well, hi, Conner. Hi, Robert. Thanks for letting me be part of your dynamic duo for this episode. I'm a fan. Now, I know you guys like to talk about American football, but today we're in the middle of the World Cup, so I'll just say this. Go Team France. France has already won 2 World Cups, right? And we're leading Group D. Team USA is not doing too bad either, but we're recording this before the knockout stage. France is set to play against Poland, and the US will be facing the Netherlands. We'll see what happens this weekend. So who's headed to the finals? Any projections?
Listen, you got a lot to be excited about in France with Mbappe. That guy is absolutely on a tear. But obviously we know that the Yanks are going to come in from the US and bring home the championship. Let's go. It's time for US.
Well, welcome aboard, Ben. We need all the help we can get today because we've put together a special mailbag episode for our listeners. And for all of you to know, we came up with this episode after all 3 of us were listening to the Brady Bros, which is the Brady brothers getting together, and they do a mailbag episode once in a while. And we thought that would be a cool idea to do this with our listeners.
That's right, Robert. And today our listeners will be the ones asking all the questions. Now, let's get into this episode. We've been hearing from our listeners, and one thing that came up multiple times is the need for more transparency. So I thought it would be great to start with the following question from Jennifer. And I'm sure, Robert, you'll explain to our listeners what transparency has to do with her question. She says, I've been listening to various news outlets touting the Mark Cuban Cost Plus pharmacy. Is this a new pharmacy concept?
Well, Jennifer, to answer your question in a short way, no. Mark Cuban's Cost Plus pharmacy is definitely getting a lot of media attention. And in fact, I was on a call with a reporter from the Rheumatologist Journal talking about this venture. There are other entities who have been well established for many years doing this type of pharmacy service, which is primarily providing pharmaceuticals and mainly the generic formulation in a cash manner to patients. That means patients walk in, pay cash instead of using their insurance cards, and they're saving tons and tons of money. So the benefit of having, though, somebody like Mark Cuban is that he does possess a huge megaphone. Everybody knows who he is. He has a nightly show called Shark Tank, I believe, and he does get a lot of attention. So I believe what he's doing is great for this whole environment because what it's doing is raising the awareness that patients have alternatives, that they don't have to use their insurance card always to save money. And in fact, in some cases or in most cases with generic medicines, they can walk into these pharmacies that offer cash prices for the generics. In fact, all pharmacies do, but these are specific pharmacies that are just offering cash prices for pharmaceuticals that are generics, and they can save a lot of money.
Yeah, and that's actually, I'm glad that that's one of our first questions because that is super topical. I think over Thanksgiving dinner, this is something that my brother brought up. My brother's not a patient, but to Robert's point, what's great is that there's somebody who has a big megaphone and a giant platform who's bringing attention to these issues of, affordability of our medications and doing his best to provide some sort of alternative, like you said. So I guess another question I have for you, Robert, is this, a new pharmacy concept? Has this been around for a while?
No, it's not new. As I said, other entities have been doing this for a while. I mean, the largest being Costco. We all know about Costco. We go in to get a lot of our foods and, diapers and paper towels and everything else, but they have a pharmacy within Costco, and Costco pharmacy has been very focused on cash paying patients who come in to purchase their pharmaceuticals. And in fact, a huge percentage of their business in the pharmacy is still cash based business. So they've been doing it for many, many, many years. It's just that, they don't have the visibility, Conner, as you know, of somebody like Mark Cuban, who is able to get this word out much more effectively than they would. And there are other smaller players that are community-based pharmacy, like Freedom Pharmacy, Blueberry Pharmacy, that provide these type of services in specific locations, which, again, is the same exact concept. Patient walks in, doesn't use their insurance card. In fact, they save money by paying cash, and these pharmacies are thriving and the patients are saving money. And that's what we want, right, Conner, for our patients?
Yeah, well, people need to hear this. There are alternatives. There are ways to pay less for your medicine. All right, so another topic that has to do with transparency is PBMs. You guys have talked about it a few times on the podcast, and Ali sent us the following question. I hear that PBMs use the rebates to lower premiums. Is that true? Is that the reason why they don't want to share the rebates with patients?
So in a short way, the answer is yes, theoretically. Longer way of answering this question is no. They don't really use this to lower premiums. They say that publicly. They say that to policymakers who are trying to investigate them, to FTC, they say that too. But the reality is that nobody knows. And that's because there's such a lack of transparency. There's billions and billions and billions of dollars collected in form of rebates and fees and concessions from the pharma industry that patients do not benefit from. And not only they don't benefit from directly, but because of this whole opacity, secretive way of how they collect this money, nobody knows how much of that money goes back, for example, if in fact they do help lower premiums. So conceptually, yes, that's what they say, and potentially that's what it does, lower premiums. But to what effect, we have no idea. And I know, Conner, we always get questions of why am I going to the pharmacy and then I'm paying these exorbitant prices while I know insurance companies are negotiating billions of dollars of rebates and savings from pharma industry.
Well, we're no strangers to PBMs and kind of the harmful practices that they participate in. And I'm always glad when people are asking these questions. But obviously, the solution to this is making sure that these rebates and these concessions are being passed along to the patients at the point of sale rather than all this back room sort of, oh, well, we're giving you concessions without being able to prove it. And something that we talk about constantly, and broken record is the need for transparency. Who knows? They could be doing this to lower premiums, but we don't know. And until that happens, we're going to keep looking out for patients and ensuring that they have the most accessible and quality medications.
Yeah, that makes sense. Looks like there's still a lot of progress to be made in that area.
Absolutely, Ben. And it starts with transparency. If we know exactly where this money is going, then we'll have a better idea of whether or not the patients are saving the money or it's going towards premium support, or most likely what is happening is profitability by the insurers and PBMs.
All right, well, that's sending a message loud and clear to our legislators out there. Transparency, that's what we need. Now, switching gears a bit to bring up another hot topic. It's winter time and there's a resurgence in oral viruses. We've talked about COVID, we've talked about the flu. Albert has a question about vaccination. Let's take Albert's question next. He writes, "Thanks, Conner and Robert, for a great podcast. My question is in regards to vaccination. You're very pro-vaccines, but I have heard from healthcare professionals that natural immunity is far better than vaccination. Is that true?"
So the question that you're asking is something that comes up often, right? These are individuals who have been infected, for example, with COVID or flu, and they're like, well, I have the antibodies now. Why do I need to get the vaccine? And the question is not really whether or not you should be getting the vaccine. The question is whether or not you should risk getting really sick or perhaps dying. And by taking the vaccine, you're avoiding that journey as a patient, right? So you can always wait to get sick and develop natural immunity. But if I was a patient, and I am a patient, I'd rather get the vaccine, get a mild sort of like an immune response, but know that I'm protected, instead of risking that I will get sick and then the outcome is an unknown. And depending on your clinical background, that outcome may be mortality, which is not something that patients should risk. So to answer your question, perhaps natural immunity is better, but why risk it as a patient? That's what I tell people. And Conner, I know you get this question all the time from our patients that call in.
Yeah, and what I think that the answer has to be is that community health has to be multi-pronged attack. You know, we can't just focus on herd immunity, natural immunity. We can't just focus on masks. We can't just focus on vaccines. It has to be a collection of all these things coming together in order to decrease the effects of these diseases that are running around. And especially this winter, where we're seeing this convergence of RSV, flu, and COVID. At any one time, I know at least 3 or 4 people that are sick right now and kids that are ending up in the ICU. So yeah, I think that it's a fair question, and we never fault the question, and there is a lot of benefits to natural immunity, but let's do it all. Let's make sure that we're mitigating all these different transmission methods and providing all the best care, and again, providing as many mitigation strategies as we can to get through this winter.
So one thing that also is important to us in Global Healthy Living Foundation, we represent chronic disease patients who are primarily immunocompromised. And at times, they cannot take the vaccine for a variety of reasons. So we depend on other individuals to be vaccinated and be protected so they can go through these hard times during the winter season without being exposed to the infection. So that's another concept that you need to think about whenever you're deciding to get immunized or not, is that, there are other individuals that may not be able to take the vaccine, or the vaccine is not effective. For example, there's evidence that patients with blood cancer, for example, the vaccine doesn't work for. So even if they get the vaccine, they don't create immunity. So we need to protect and think about not only ourselves, but us as a community, because at the end of the day, we're trying to interact with people and we don't know who you're interacting with, and there are patients who may be immunocompromised or that the vaccine is not effective.
Well, actually, since you're talking about our community, GHLF's community, Conner, I have a question for you. As a patient advocate and community outreach manager at GHLF, how have you addressed those issues with our patient community?
Well, always the first thing that we're going to suggest is you talk to your doctor and figure out what's the best course of options for you. The second thing is to be educated, find reputable sources. And I think that that's a really important piece right now in the age of misinformation, is to find things that are actually true and peer reviewed, and trust the scientists and listen to the scientists. And then, find community, find folks that are going through the same thing that you are, and talk honestly and openly with them. These things, these hesitations, they shouldn't be treated as, we shouldn't ostracize people for asking questions and feeling nervous about these things. What we should do is be encouraging them, giving them the education information for them to make the right choice, which is to follow the science and get vaccinated, or listen, again, like I said, listen to what their doctor has to say. Robert, what do you think?
So one more thing I would say is tune in and listen to the podcasts that are put together by Global Healthy Living Foundation. I mean, we do the Healthcare Matters podcast, but we have several other podcasts in our podcast network that talk about specific disease areas. We have somebody who focuses on psoriasis and somebody who focuses on migraines and pain. So dial in, listen to our podcast. We provide a great deal of information. We try to bring down the level of the discussion to a patient level, because that is important, right? We're not trying to here in these podcasts convince healthcare professionals, or we are not trying to demonstrate that we can go toe-to-toe with an academician. What we're trying to do is convey information to the everyday patient who's looking for answers, and that's our audience. And that's what we take very seriously, and we do this with every single podcast that Global Healthy Living Foundation puts together.
And should we add that at GHLF, we're also advocating on behalf of the patients, but we're also providing them resources and helping them to be their own advocates, right? So how can people get involved and become advocates?
I strongly encourage folks to go check out the 50 State Network, one of GHLF's advocacy arms, and get involved that way. Sign up, tell us your story, and work with us to elevate these stories. We'll give you a megaphone. We'll make sure that legislators and folks that are at the tables of power and the powers that be, that they're going to hear your experience and hear you out for how their decisions impact your life, your care, and your health. But ultimately, just take that step. Be loud. Take up space. You deserve to be heard.
Well said, Conner. And finally, we'll hear from our good friend and colleague, Zoe Rothblatt. She's the Associate Director of Community Outreach at GHLF. And she's also the co-host of other GHLF podcasts, including The Health Advocates, and also Breaking Down Biosimilars. With you, Conner, actually.
Yeah, I've heard of her.
So let's listen to her question now.
Hi, it's Zoe. Thanks so much for having me on. I have a question for you, Robert. I've had fellow patients tell me that they're thinking about going on a biosimilar instead of the brand name biologic that they're currently on. And they ask me if biosimilars are safe. And they ultimately wonder if their condition is going to get worse if they use a biosimilar. We get this question a lot. And as a professional, what's your response to those patients?
Hi, Zoe. First and foremost, so good to hear from you. Second, I would say you need to talk to your healthcare professional that's managing your care, whether it's your physician, your pharmacist, your nurse practitioner, your physician assistant, whoever you're going to that is providing you the care. That is the first person that you should approach about these questions. They can provide the best answers because they know exactly what you're going through as a patient. The second thing is more of an academic answer, which is I will give to anybody that asks. Biosimilars are absolutely safe and absolutely as effective as the brand biologics. FDA has approved these medicines. They go through rigorous research and development process. It takes several years, several hundred millions of dollars to be able to bring these drugs to the market. There is a lot of science that goes behind it. There's a lot of regulation. There's a lot of scrutiny. There's nothing to be worried about. These drugs, as a patient, you're going to get the same response as on a brand biologic. Now, the big question for patients and patients like yourself is that if you're willing to do this, right, to switch to a biosimilar, the question you should be asking is not really from your healthcare professional or your pharmacist or anybody else, but from your insurance company is that whether you or not, you're going to get those savings passed on to you directly at the point of sale instead of being hoarded by the PBMs and insurers. So that's the one that I'm always concerned about. And at GHLF, we're always concerned about is that will the patient benefit from something like this? Rather than the insurance company and PBMs pocketing the difference in savings and taking it as profit.
Well, thank you, Zoe, for sending your question. And thanks, Robert. As usual, it was very clear. Thanks for breaking down all that information for us. And thanks a lot to the two of you. We talk a lot behind the scenes, of course, but it was really nice to be able to have this conversation on air with you guys.
Thanks for coming, Ben. I really had a blast with you today, and I can't imagine this will be the last time we have you on air. It's always great to hear directly from our audience, and we hope to continue hearing from you. As always, Robert, we want to make sure you get the last word in here. What do you think?
Number one, we picked up something from the Brady Bunch crew, which is to do this mailbag episode. Number two, Ben, thank you for joining us. And number three, please, as patients, reach out to us. We're here to help you. Our telephone lines are open. Our emails work really well. We get text messages all the time. And Conner needs to be really busy because that's his number one job, which is to take your calls and talk to you and help you out in your journey as a patient. And we're all here to support you, so don't be shy. Pick up the phone. We're here.
And don't forget to subscribe to our podcast on Apple, Spotify, or wherever you may be listening so you'll never miss an episode. And if you have a second, help to spread the word by rating our podcast, writing one of those awesome positive reviews, and sharing with your friends and family. It'll help more people like you find us.
And you can also send an email or audio clip, similar to what Zoe did, to healthcarematters@ghlf.org. And you might be featured in one of our upcoming episodes, just like we did today. We love being challenged by all of your questions. And before we go, make sure you listen to some of our other great podcasts that we mentioned on our podcast today.
Great point, Robert. Shameless self-promotion here, but we mentioned earlier, along with my friend and colleague Zoe, we host the podcast Breaking Down Biosimilars. We explain what biosimilars are, how they get approved, their potential savings, and the promises that they hold for the future. And remember, you can find all of GHLF's podcasts at ghlf.org/listen. As always, he's Dr. Robert Popovian.
And he's Conner Mertens. We'll see you all next time. Go Trojans. Go USA.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.